Hi, I'm Deborah Proctor, the President and CEO of St. Joseph Health System. I'm so proud of the work we've been able to do through the St. Joseph Health System Foundation. You know, I was here at the start of the foundation back in 1986, and I know what Sister Suzanne's vision was. She had in her heart that we ought to be able to spread our good fortune to others in the community through programs that help those who are most in need. Part of our goal is to help communities learn how to take care and identify their own needs, and then how to develop the leadership skills to address those needs. So we've done grants to many communities across the state in terms of trying to help them learn how to do that community building. We've been feeding bodies and nourishing souls in Sonoma County. We've been educating parents and children together in Napa, building healthy communities one smile at a time in Orange County. Taking healthcare out to the community through our mobile clinics in the high desert, helping with prenatal care in Humboldt County, building communities and even a playground in Fullerton, helping those less fortunate find a way back to a home in Orange County, providing mental health services and adult dental care in Lubbock, Texas. These are just a few of the things we've been able to accomplish.
First of all, remembering 25 years ago was quite a task. It was kind of fun to go back and reflect on where we started, and how we got to where we are. The roots go back to where Catholic healthcare roots goes, the scriptures. And the scriptures are full of healing stories of Jesus, and so many of them. The lame walk, the blind see, the deaf hear. One story that for many years, I would bring to orientations at all levels, and that's the story of the Good Samaritan. You're familiar with everybody with the Good Samaritan. And two things there I think are significant. There's a young man talking to Jesus, and he says, "Who's my neighbor?" And then comes the story. And then the last sentence of the parable is the mandate. And Jesus says, "Go do the same." He doesn't know anything about taking care of the sick or the wounded. Probably nobody else did in society. But it's the approach with compassion. That's what the scripture says. You approach him with compassion. The mandate is, go and do the same.
I'm David Goodman. I'm the Executive Director of the Redwood Empire Food Bank in Santa Rosa, California. The Redwood Empire Food Bank is the largest hunger relief organization in Sonoma County, serving 78,000 people every single month, as well as 149 nonprofit or faith-based organizations that serve people in need. One of the most exciting things that we've been able to do with the St. Joseph Health System funding is to operate our Megan Firth Harvest Pantry.
Hi, good morning. My name is Min, and then I've been in this program around 2.5 years. And I really like this program. I think it's really helpful to have family.
The hope that I have for the St. Joseph Health System Foundation is that they continue to thrive. Their success is our success. The mission of the Redwood Empire Food Bank is to end hunger in our community, and what that means to us is that anyone who is in need of food assistance can turn to some place and get the food that they need to be healthy and productive.
In addition to food assistance, we also provide nutrition education to food recipients.
This is kale. La kale es rica en hierro y también rica en vitamina C. 3, 2, 1. 5 frutas y 5.
The St. Joseph Health System Foundation is so beneficial by getting behind the food bank and giving us this wonderful opportunity for nutrition for all those we serve on a regular basis. Thank you.
I often reflect on the fact that we are really the 911 for people in need of food. When somebody is suffocating, they call 911 and a paramedic shows up and provides them with oxygen. But when people are running out of food, and if they were to call 911 and say, "I'm out of food," no one's going to come. And that's the role that a food bank plays in the community.
Hi, I'm Liz Baer, the CEO at Healthy Smiles for Kids of Orange County. Although Healthy Smiles is located in Garden Grove, we serve children throughout all of Orange County. Our partnership with the St. Joseph Health System Foundation has enabled us to grow and strengthen our programs, which means we have staff members who speak Spanish and are able to interact with the families. And our staff come from the surrounding areas. They are very compassionate.
Hi, my name's Naseem Majarad. I'm Dr. Naseem Majarad. I'm a pediatric dentist at Healthy Smiles for Kids. The most important thing to me about what I do is that dental caries is the #1 disease in children, and I see cavities day in and day out. Without this funding, we would not be able to treat these children. These children would go on untreated.
Imagine, when we have a toothache, we want to go to a dentist. These children don't have any place to go. When children have oral disease, they're in pain and suffering. They can't study, it's difficult for them to eat, sleep, chew, swallow, and more importantly, their self-esteem suffers. We had a 3-year-old a couple of weeks ago who came in. She hadn't been eating well. She'd actually been losing weight. She had an infection that had to be medicated before they could start the treatment on her. She and her mom are doing great. We see stories like that every day, and it's only because of your support that we're making a difference. We're changing lives one smile at a time. Thank you, St. Joseph Health System Foundation.
Oh, when you smiling.
Hi, my name is Joanne Neal. I'm manager of Covenant Counseling Center with Covenant Health System in Lubbock, Texas. We are a counseling center. We see persons with mental health issues. Without Covenant Counseling Center being here, there are persons in the community who would not have access to mental health services at all. So they can come here. We do not turn anyone away for lack of ability to pay.
Hi, my name is Randy Tungate. I'm a licensed professional counselor with Covenant Health System in Lubbock, Texas. I think one of the things that makes me the proudest about the work that we're able to do here at the Counseling Center is that we're able to minister to people. One of our mottos is body, mind, and spirit, and we truly are able to do that here. And so I look forward to coming to work every day because we have an opportunity to meet people's needs in those areas.
I think the thing that I'm most proud of, and when I unlock the door every morning, I pray and I ask God to use us as salt and light on this corner in downtown Lubbock. And I know that there are a lot of people out there with needs who are going to be calling or coming in on a daily basis. And the way I like to, I guess my passion for counseling and being in this type of setting is the fact that I say, God uses me as His instrument in this setting, and I get the privilege of having a front row seat to what He works out in people's lives.
Just joining us, we're following the breaking news out of Haiti. The largest, most powerful earthquake in the region's history has crippled the country. Its epicenter was just a few miles outside the capital, Port-au-Prince. There are reports of toppled buildings there. We've seen pictures of
One
dead
impact
bodies.
of that earthquake was the total destruction of the main hospital in Port-au-Prince. In Haiti, Catholic Relief Services determined that it would be very important to rebuild that hospital as soon as possible. We were asked, as part of the Catholic Health Association, to be part of an effort called a Campaign for Rebirth and Renewal. I requested a pledge of $500,000, and our foundation decided to commit $1 million. And that $1 million stimulated gifts of over $11 million across the country. This is something that Catholic hospitals are doing in conjunction with Catholic Relief Services in Haiti. So we've now pooled our money, that $11 million, with money that Catholic Relief Services has raised, and now have the total budget that's necessary to rebuild that hospital in Port-au-Prince. I'm very proud of us for that action, because this is so exemplary of the fact that we reach out to the dear neighbor, and we don't see the dear neighbor as only in the communities we serve, but as a part of the global community for whom we want to be responsive.
transformation,
enhancement,
unity,
fulfilling,
helpful,
esperanza,
justice,
partnerships,
just,
prosperity.
It's 2 words. Fantastic stewards.
wholeness,
abundance, thankful.
One word is heart,
Commitment.
Transformation.
fulfilling,
collaboration,
supportive, compassion,
Hope.
responsibility,
helpful,
validated,
light,
collaboration.
Vision.
My word is fulfilling,
leaven,
transformation,
gratitude,
great,
compassion,
Hope.
new life.
I have one word, and that word is catalyst. It's difficult to sort through all the words, but the reason I choose the word catalyst is that what's important to us is the growth and the health of our communities. And while we can't provide all the care that is needed in our communities, the one thing we can do, especially with the dollars that we give in grants, is to be a catalyst for a lot of actions. When I think about catalysts, I think of something that spurs on many actions down a line. I want to take this time to say thank you to so many people who made this possible. First, I want to say thank you to our community benefit committees of our local boards. You've been such a great help in determining where our dollars should be spent. I want to say thank you to the Care for the Poor programs that are operated in each of our local ministries. I want to say thank you to the CEOs who have remained committed to this over the 25 years of its history. And I want to say thank you to our staff at the St. Joseph Health System Foundation. Without all of you, this simply wouldn't have been possible. Thank you.
Thank you, St. Joseph Health System Foundation.
Gracias, St. Joseph Health System Foundation.
Congratulations, St. Joseph Health System Foundation.